Rural FASD is thrilled to be able to announce the launch of our environmental scan and gap analysis report that we have been working on over, it's actually been a little more than a year now in terms of from start to finish, I guess. This project came about as the result of a partnership that we established with Carleton University, where they had one of their Bachelor of Social Work students intern with us for her practicum. That individual was Brooklyn Robinson, and she did, as you're going to see, an absolutely amazing job in terms of capturing all the information that we wanted to do, capture within this report. The environmental scan, what it was looking at is, number one, we identified what sectors were needed for people with FASD to be able to achieve healthy outcomes. And so we used the document that was established by Dr. Jacqueline Pye that CanFAS recently published just a couple years ago. And if there's also a series of videos that she did in conjunction with this documentation that, if you ever get a chance to watch those, would be highly recommended. But she identified that there are 12 sectors that need to be supported for people with FASD to achieve a positive life outcome. We also identified that there are 4 age groups within those 12 sectors. And so in reality, there are 48 different areas that are required to, that are in needing of support. So we first of all wanted to identify were all 48 of those sectors currently served within the counties of Lanark and Leeds-Grenville. And through the help of MPP Steve Clark's office, we were able to reach out to basically almost every service organization within the 2 counties. We spoke with 69 different organizations, and out of those 69, 42 of those organizations agreed to participate in this research study. And so we began with identifying what services were provided and the age sectors, where they were located, contact information, and so on. And then following that, we then identified how many of those services were FASD informed. And so at this point, I'm going to start the presentation. Before I do so, though, we do want to acknowledge that we are on the unceded and traditional territories of the Algonquin people, where we thank them for the opportunity to work, play, and pray. And so at this point, we will begin the presentation. Recognize that FASD is a spectrum disorder, which is going to impact a lot of different aspects of their life, including their mental health and self-regulation. And so it's not just enough to be able to support them from their, in terms of their mental health, but at the same time know how to collaborate and what type of referral process that you should be looking at to help support in some of those other sectors that might be impacted by the disability. And so that's what I'm here to present today. But to begin with, the presentation that I want to present to you today is we have here at Rural FASD, we have just recently finished off with the help of Brooklyn Robinson, the very first environmental report on the counties of Lanark and Leeds-Grenville. And so it really starts, we wanted to start with making sure that we were using evidence-based practice as to what this environmental scan should look like, what are the sectors that you need to be aware of that potentially are going to be impacted by this disability, and more importantly, whether those sectors are currently supported within the counties or not, and exactly who they are. And so we looked to a seminal document, a research document that was done by CanFAS about 3 years ago now, called Toward Healthy Outcomes. The lead researcher was Dr. Jacqueline Pye, And what she identified was there are really 12 sectors that are impacted. The first two sectors that are impacted are physical health and attachment, and they will come into play right from the day that the child with FASD is born. And as you can see on the chart in front of you, each of these sectors become more and more prominent with age. They certainly exist all the way through the lifespan, however, and need to be supported through the entire lifespan. As you can see, as you move up the ladder then, as the child becomes a toddler, family cohesion and social functioning become extremely important. This is where speech language pathology really comes into play as well, is around that social functioning. If you can't communicate with your classmates and childcare peers and so on, you're really going to struggle with in terms of even developing that social functioning, and we've seen that repeated lots of times. As we move into the teenage years, this is where mental health and self-regulation become extremely important. The educational system, in terms of being supported there, becomes very important. As we move more into adulthood, identity development and community engagement then come into play. And then finally, from an adult standpoint, having those adaptive skills, housing concerns, employment concerns, and even developing parenting skills are really the 12 sectors that we need to see supported in order for people to achieve those healthy life outcomes. What's important to recognize, though, is all 12 are required to be supported in order to achieve that. And through that, there are three main thoughts that we need to be aware of. The first one is we need to approach the 12 sectors from that developmental lifespan perspective. That FASD is a permanent disability. It's not one that's temporary. It's not one where if we support for a year or two that everything will be developed and everything will be fine after that. It is absolutely a lifespan perspective. And as a result, it is why through all those ages, right up till elderly, that the support needs to be in place. The second one, though, that is important to recognize is there also, when you have interactive systems where all 12 of these are in collaboration and working with one another, that it's not a sum result, that it is an additive and ongoing influence. And what we mean by that is we know that whatever support may happen within, for example, the mental health sector, when it's in combination with a second sector, for example, housing, the benefit of that and the impact that that has is way beyond what just those two sectors in isolation may be able to provide. And so we recognize when you have all 12 that overall impact that it has is way beyond what each individual sector would be able to provide. And then finally, the key to all of it, and this is where we're going to be hearing from Shelby at the end, is our approaches must always be strength-based, they must always be empowered, and they must always be goal-oriented. And again, when we think about that strength-based aspect, we all have challenges in our life. And those challenges, that's where we go to our supports to be able to help us overcome those challenges. But the supports that we need to tap into are what our strengths are. We know that, for example, most of the time we will go into employment opportunities that tap into our strengths. We're not going to go into employment opportunities where the job is constantly hard and constantly needing help at and constantly needing support in. We know that we're going to go into employment opportunities where we're going to be able to do things that we're good at and we enjoy doing and we find success over and over and over. And so just like any aspect of life where we're always looking to tap into those things that we're good at, where we always see success, where they're strength-based, it's the same way with someone with FASD. They must also be empowered. And empowered, this is where the collaboration piece becomes so important, because that empowerment means giving them a voice to be able to share what they know and understand, and do it and communicate in a way that we can understand that. But to expect them to have the same communication levels and to have the same communication skills as us is unrealistic. And so this is where the collaboration piece becomes extremely important, where we're going to help them understand those strategies. Just like, as you know, lots of times in mental health, there are things that serve as triggers. And so what we look at doing is helping the client identify what those triggers are, and then providing them with strategies that allow them to manage them when they may arise, so that they do not become negatively impacting our life. And so that's empowerment. That is giving the client those skills and those abilities to be able to take it on and manage it independently. We always use the phrase, we're always looking to work ourselves out of a job. We're always looking to provide that empowerment aspect where someone is able to function independently, where they're no longer dependent on us to be able to provide that support. And then finally, goal-oriented. We have to know what we're working toward. We have to have a realistic objective that we're always working toward. And so as we put these strategies in, as we do these different aspects and supports, it always has to be with what that end goal is. And that end goal is always very different from client to client. And it's always, at the same time, we always want to say that we need to shoot high. For the longest time, there has always been a very low goal objectives for people with disabilities. And we're seeing in our culture today and in our society today that people with disabilities, very much when it's strength-based, can achieve great things. And when they're done in a supportive and inclusive manner, there's no reason why that success can't be achieved. And so we always want to shoot high and see if we can achieve those goals. At the same time, if you want to read more in terms of the Toward Healthy Outcomes, the full document is here within the slide deck, and you will have an opportunity. The slide deck will be shared with you afterwards. Dr. Pai, though, has also done a series of videos explaining in great detail each one of the sectors, and you may find them to be helpful as well in terms of that additional resource to tap into. And so it was with that in mind that we wanted, that the Rural FASD wanted to apply the Toward Healthy Outcomes specifically to our area. And so just as a little bit of a background in terms of how the environmental report came about, first thing that you should know is in 2015, the only to date Ontario-based environmental scan on FASD was conducted. And it was conducted at that provincial level where it was done through MCCSS at that time. And it then resulted in the first legislature related to FASD being passed. And that's actually where our FASD workers today came from. It's also where our support groups came from, was as a result of that environmental scan being done. At the same time, though, in 2015, the Truth and Reconciliation Commission released their 94 calls for action. And while most people are very familiar with the commission and the 94 calls for action, we certainly find that a lot of times people think of that as being an Indigenous document, and it's not. It is a document that, yes, it very much focuses on pertinent Indigenous issues, but it's also at the same time a reflection of our society in general. And so within the 94 calls for action, the 33rd call for action actually calls for FASD preventive programming being established throughout the entire country of Canada. And to date, that has not been done yet. There has certainly been starts on it. Within the calls for action, there is absolutely a piece that looks at it, making sure that it's also including appropriate indigenous cultural methods, but it's also calling in general for preventive programming and bringing FASD awareness to how FASD is developed through our entire society. And then number 34 actually calls for our federal, our provincial, and our local governments to come together and establish FASD community supports. Again, the focus is very much on those who have been incarcerated and have been determined that the life choices that they had made up until that point are being impacted by FASD. And so it's also focusing on wanting to lower that recidivism so that folks that have been incarcerated are not reoffending due to a lack of community support. But at the same time, it also makes it very clear that it's not just folks that have been incarcerated, that there is a need for community supports and programming for everyone with FASD, whether Indigenous, whether they have been incarcerated, or whether they are just someone who is in our general population today. The other part of what Call for Action calls for, though, is that those supports and programming are also evidence-based, and that they are being evaluated regularly for effectiveness and looking for the documentation and the research behind it to demonstrate that these types of programs are working and making a difference in people's lives. And so in 2017, led by the Leeds-Grenville Developmental Services, the Lanark Leeds-Grenville FASD Working Group was formed, and it was through this introduction that caregivers and service providers came together for the first time in our two counties. And it was through those initial conversations, and I would also point out that Open Doors was there right at the very beginning, and huge kudos to all of you for being on this journey from the very beginning. But it was also recognized at that point that there was different agendas, and there was different needs from both the caregivers as well as the service providers. And so that's really where Rural FASD came into being, was to serve as that supplemental voice for caregivers to be able to work in collaboration with service providers. And so from all of that, there was a joint placement that was done with Open Doors for Lanark Children and Youth, and Brooklyn Robinson from Carleton University's School of Social Work conducted the very first environmental scan at a local level within Ontario. And through that scan, there was three main objectives. The first one was to determine the current level of FASD awareness amongst all service providers within the two counties, to then write a full report with a gap analysis to see if capacity for the 12 sectors existed or not, and then finally provide a comprehensive listing of all the organizations that provide for those sectors. And so the environmental report, the first thing that you should be aware of is there is the area associated with, and I'm just scanning down very quickly here. The way it is set up is we broke it out according to the 12 sectors, and it follows right along the same order as the toward healthy outcomes. And so we start with physical health. And so the first part, starting on page 19, looking at physical health, there's a little bit of a definition on what physical health is and some of the research as it relates to FASD. But then following that, you will see that every organization that provides physical health support, whether it's FASD informed or not, is listed within the two counties. And so Algonquin College, the Perth campus, does provide a variety of medical services. All contact information is listed here as well in terms of how to get a hold of them, their website address, and a brief description. And so as you can see, for example, with physical health, we have followed by Algonquin College, there's CareBridge, there's Connect Well, listing all the different services that they provide and their phone numbers and contact information, County Roads, Kids Inclusive, Ontario Works actually provides in terms of some funding and the coverage related to it, Rideau Community Health Services, the Table Community Food Center in terms of some services around it, and so on. And then you can see we then move into the second domain, in this case is attachment. And it just follows that same order. It has that initial definition followed by the organizations that are listed. They are also completely listed in the table of contents. So if there is a particular area that you're wanting to look at, you can look up exactly the page number. So for example, if we wanted to see this open doors, particularly around mental health and regulation, we would go to page 68 and we would be able to locate it there. It is important to recognize that a lot of our organizations, Open Doors is a great example of this, provide services much beyond just the one sector though. Open Doors is listed, in fact, I want to say, I think they're actually listed in 7 different sectors, depending on the programming and the service that you guys offer. And so it is Open Doors contact information as well as the description of the service is listed in the appropriate domain. And so, like I said, these services are not specific to FASD, and that's a really important consideration to keep in mind here, because obviously you're working with clients who do not have FASD, but may have need for those community supports. And so that's really what this document is designed for. Is to help in terms of those collaboration pieces. We know that empowerment is always through education. And so by providing this resource to you, it is certainly our hope that that all the organizations are going to be able to break down a lot of the silos that a lot of organizations, some of the organizations are working in right now, and really being able to serve clients better. The second part that I want to refer to, though, is related to the gap analysis section. And so following the listing of all the domains and the organizations, Brooklyn then continued on with the gap analysis. And the first thing that I want to bring attention to is the fact that there was 69% participation rate. And I want you to, it's important to recognize that when Brooklyn was contacting these organizations, that it was realistically a cold call to a large extent. And the individuals that she was having these interviews and conversations with were generally executive directors or program managers. And so when you look at the fact that 69% of organizations not only returned phone calls and requests to be interviewed, but actually then conducted the interview and participated in this environmental scan, really speaks to just how large of a need all the organizations in our two counties recognize in terms of the importance of this report and being able to provide some really strong validity and data around it. And it also speaks at the same time to their desire to want to better serve and help people with FASD. And so that was wonderful to see. The second thing that we determined, though, is we were able to determine through a line of best fit based on just the current population and geographical size of the two counties, that in order to be able to fully serve any sector, that there needed to be at least 14 different options. that people could tap into in order to be able to fully serve within that sector. And so that was the first part. The second part that we looked at was we also needed to make sure that we split it into the 4 different age groups, because we recognize service within each of these 4 age groups is also significantly different. Obviously, mental health support for a child ages, newborn to age 9 is going to look really different for someone who is a teenager or ages 10 to 17 needing mental health support. That's also going to look different, obviously, for someone who is an adult needing mental health support. And then finally, elderly support is also going to look different. And so each of the sectors are broken out into those 4 age groups. And so that's why there's actually 67 sectors in total between the 12 sectors and then the 4 age groups. And so we were able to determine that capacity right now is being met in 43 of the 67 sectors, that there is still 24 sectors that did not meet that minimum threshold of 14 different options. The one that was the most interesting to us, though, was community engagement. And community engagement was the only one of the 12 where all 4 age sectors are currently being underserved. And when we think about community engagement, what we're talking about here is really opportunities, particularly for people with FASD, to be able to participate in events and festivals that might be going on, to be able to participate in recreational opportunities. And so most of the time when we think about community engagement today, we tend to think of this as being a municipality or volunteer-based type of organization. And this is where the report and the gap analysis became extremely helpful for rural FASD. And one thing that we really want to bring awareness out on is that it is by far the sector that is the least served right now. And when you think about what COVID has brought out, it should also be important to note that this report, that while yes, it was happening during COVID times, it's reflecting the community engagement level, though, before COVID. And so coming out of COVID now, we understand this has to be our priority moving forward. And it needs to be the gap that we want to fill first, is being able to provide those community engagement opportunities, whether it's through recreation, whether it's being able to find volunteer opportunities for folks, whether it's being able to get connected with some of the other service organizations. And again, this is where getting connected with all these different organizations within the environmental scan, there's volunteer opportunities even within them. And being able to share personal stories with people that at the same time might even possibly be serving clients is just a win-win for everyone. The second one that we also did within the gap analysis is we wanted to be able to determine how FASD informed an organization was. And so we laid out the following criteria that basically served as determining what that level was in terms of how FASD informed an organization was. And so level 1 is when an organization basically has no FASD training, or there really isn't any individual who has had any FASD training within the organization. That there is a general understanding or a general awareness of it, but in terms of being able to understand some of the specifics, and particularly around strategies, that there really hasn't been any training at all. Number 2 is where the organization may have a few staff members that have been through training to some extent, that might have some understanding of different strategies and so on, but it's not organizational wide, that it's still contained within those few individuals. Level 3 is where there are staff members who are extremely FASD informed, really can serve as knowledge capacity champions within the organization, but it really hasn't been disseminated all the way through the organization yet. And then level 4 is where the organization has received across the organization training to some extent, where there's definitely everyone has an understanding, but at the same time it's not part of the orientation, and so the training is needing to the knowledge capacity is still kind of going up and down, particularly when staff turnover happens and so on. And so that is really considered the level 4. And then the level 5 is where there is organizational training throughout, where all clients and service providers are fully trained and understand the strategies and how to serve. But at the same time, there's also a sustainability aspect to it. And so it's part of orientation. It's part of an expectation that every employee and every staff member associated with the organization is FASD informed. And so what's important to recognize here is out of the 42 participating organizations that participate in the gap analysis, there are 2 who are currently meeting criteria 5. One of those organizations, not surprisingly, I suspect, is the Rural FASD Support Network. And then the other organization is actually the St. Lawrence Youth Association down in the county of Leeds-Grenville. The other part that's important to recognize, though, is out of the 42, 22 organizations identified themselves as being at level 1. And so it speaks again to when we look at the recommendations that are made within the environmental scan, that is the one that gets repeated over and over and over again, that there is a need for more training. There is a need for more FASD awareness. There is a need for, in order to be able to better serve clients with FASD, that service providers are absolutely needing more training. What was really neat to see, though, is the organizations already know that, and in fact repeated that over and over again. And so when we look at next steps, the question that was asked at the end of the interview was, if there was something that you could add to your organization that would allow you to better support people with FASD, what would it be? And you will notice that our percentages there don't actually add up to 100%. And the reason for that is because some organizations actually gave more than one answer. And so that is reflected within those percentages. But what you are seeing is when it says 57% of organizations stated more training on FASD would be their ¡1 request, that is 57% of the 42 participating. And so again, there was actually 25 of the 42 organizations said that that's what they would want to add, is simply more training. 31% of organizations said being able to employ FASD informed staff would be a huge part in terms of building that knowledge capacity within their organization. 26% said that having knowledge of the community supports for system navigation would be extremely helpful to them. And then finally, there was 12% that said having knowledge of FASD and identification. 12% said that having a community outreach contact. 12% said, surprisingly, it was only 12%, said more funding. But again, it was a recognition, I think, that the resources to a large extent are already there, that it's really more around that education piece and that training piece, more so than being able to add capacity. It's really using our current capacity and being able to use it better. And then finally, 12% said transitional support as well. When you look at this, the organizations made it very clear, though, that there's really 2 or 3 main themes that are getting repeated. And again, it's around that training and education piece. It's also around being able to have that contact person, that champion that they can turn to when, especially when you get into some of those more trickier situations where you need to have that increased knowledge capacity and so on. And so this is why the Rural FASD Support Network is absolutely thrilled to be able to tell you that we are now in a position where we are hiring a full-time program coordinator. We're also thrilled to be able to tell you that Open Doors for Lanark Children and Youth is also serving as our organizational mentor, so that we are able to use that program coordinator in the most efficient and most effective way possible to be able to serve those needs. And what you should be aware of is this coordinator, because it is not being funded through any particular ministry, that it is not age dependent. This coordinator is able to work with any client with FASD. And in fact, we would even say that we recognize that there's going to be, I'm sure, opportunities to even be able to serve as a voice for people with disabilities in general. But this coordinator is going to be able to, is going to be fully versed in being able to provide FASD training such as this moving forward, both on a, hopefully on a one-on-one basis at times, as well as from a more organizational standpoint. They're going to be able to serve as that system navigator for both service providers as well as people with FASD. They're going to be well versed in being able to share some of those characteristics related to identifying possibly people who have FASD, and then finally serving as that community outreach contact during those business hours, and being able to have that flexibility to work with different people. And so that concludes our presentation related to the environmental scan and gap analysis report. As I think you can probably see, we were actually recycling that one a little bit from a training session that we did earlier this month for Open Doors for for Lanark Children's and Youth. But we did want to very quickly give you just an update in terms of some of the things that came out of that video, and that is the environmental report itself has it has now been published through our publisher, and the graphic designer has also completed her work related to it. So we are expecting to actually be able to release it out to the public here in the next week or two, we're anticipating now. The other one that we wanted to communicate as well is, as mentioned, the program coordinator role is continuing to be ongoing, and is we are in the midst of the hiring process. There has been a very strong response to the ad that has been put out, and we're very excited about the candidates that have stepped forward. So we are hoping to be able to share with you some news in the next 3-4 weeks, I'm going to say. So at this point, we want to thank our studio audience for joining us here once again. As we move into our summer months, we are once again going to be taking our summer break. So we will see you back in September for our next series of speakers.